Hi, thanks for joining me. I'm Dave Elliott, and we're going to start with that help coming to our hospitals. Joining us to talk about this, Singing River Health System CEO Lee Bond. Lee, thanks so much for being with us. Right off the bat, before we talk about the help that's on the way, describe the current staffing situation for you and what you're having to do with juggling personnel to manage this critical care.
It's all hands on deck. We've got people working extra days, extra hours, non-clinical people helping answer phones. And it's tough because we've lost, as you know, if you've heard, over 2,000 nurses out of the state of Mississippi. I heard yesterday that there's 500 less enrolled. So this is a long-term problem, not just a short-term with COVID. But it's very challenging, and I'm just proud of all the healthcare workers in the state of Mississippi that are really doing what it takes to try to help our people of our great state.
Now, help our viewers understand how competitive this market is right now and how other cities, the Birminghams, the Dallases, the Atlantas, are able to pay these health workers more. And then these health workers are taking, I hate to say taking advantage, but they are going ahead and kind of moving to some of these markets.
Well, it's not their fault. If you don't have kids and you're want to travel the world, the world's your oyster right now, so you can't blame them. The issue is that Mississippi's a poor state with sicker people, and we have mostly not-for-profit health systems in this state that don't have a margin. Look, if I could pay them all what they're paying, we absolutely would find a way to do that. But there are richer states with expanded Medicaid that have more federal money throughout the country that can pay a lot more right now. And so Mississippi's not in a position to compete with that. Well, they weren't. Now, again, if you don't mind me saying, the state's going to get $1.8 billion. And the math changes when you're talking billions versus millions. And if we just had 25% of that, that's enough to give there's others, RTs and other techs, but just for RNs, for example, you could give every RN $20,000 for a 2-year retention contract for those folks that are still on the bubble thinking of leaving. And if we don't do that, I think more of them are going to leave. And God bless the ones that have had the compassion and grit to stay in the community, but you can't blame someone when they can make 3 times what they can make for doing that. It's not their fault. It's our fault.
Now, we're going to circle back to that, but let's go right to the announcement made by the governor this past week. MEMA contracting with 4 vendors. 61 hospitals in the state are going to be helped. We're talking about 800 plus nurses, nurse practitioners, respiratory therapists, even paramedics. Have you heard, you're a tier 1 hospital, so you're going to be eligible for more. Have you heard how many people you're going to be getting into your system and when they're going to start arriving and getting to work?
A little. We've heard that they're trying to get them. We've asked for 53 RNs. We have not received any. We have received 2 EMTs, and we got over a dozen respiratory therapists, and we're happy for those. But again, that's a short-term solution. It's a Band-Aid on a wound that needs stitches and staples, and so we're appreciative for them. But I'm afraid by the time that some of those RNs arrive and us able to open up beds, it may be weeks from now and too late. And so again, we appreciate the help, but there's a longer-term, bigger problem here.
Yeah, this is a quick fix. There's no doubt about that. And again, we're going to go back to your idea because I support it. I think most people, right-minded people do. But when these new workers come in on this temporary contract negotiated by MEMA, will they essentially be in to cover other areas of the hospital so your current staff can concentrate more on the immediate COVID issue?
Well, it's a little more complicated than that because they'll have to integrate with others to learn the electronic medical record and the nuances of where everything's at. So they'll pair up with people, but that hopefully will allow us to expand our capacity and take some of the people from central Mississippi that get routed to us through MedCom and people, that come in from other areas. But it's tough because, say you're a nurse that's been here loyal for 15, 20, 30 years, and you got a person beside you that's making 4 times what you are. It's just tough for the psyche. And, from the math standpoint, again, when you're talking billions versus millions, we can only afford about 6 to 8% contract. And FEMA and MEMA, I mean, I don't know where they get all their, I guess from the federal money, they're able to do this. And it's a tough equation, Dave. But yeah, we'll be able to open some more capacity with them, hopefully, if or when they ever get here.
And what about just in general in terms of PPE and everything else? All of the things that at the beginning of this pandemic we were worried about hospitals maybe having a shortage of, ventilators even, and all of these other things. Do you feel like Singing River Health System over the last 15 months or so has been able to secure the necessary amount of personal protection equipment?
Yeah, we're in pretty good shape overall. I will say that we have started reprocessing the N95s out of concern of future world supply, just to be on the safe side. We did in this wave have a harder bump against ventilators. We didn't need extra ventilators in the first, second, and third wave, but in this wave, we have had to get a few ventilators from the state. I'm a little concerned about the oxygen supply. For a lot of people that are not necessarily in the hospital but on home oxygen. That's a concern growing in the region, especially with the hurricane coming in. So that's a concern. But generally, we're okay on PPE. We need RNs to open beds is what we need.
Okay, now let's go back to this request you've made, and you've made a very convincing argument. The question is, how will the state respond to that? Because I don't need to tell you, government sometimes moves like molasses, and there's a debate in Jackson over whether or not the governor has the power to do this with the federal relief money, or if the legislature is going to have to do it. And meanwhile, you guys are standing there saying, we need it now. What are you hearing?
Right. So we're hearing that, of course, if you're a politician, you're going to say, yeah, we want to help. Well, those are just words. We want to see the action. And this is an emergency that is going to have deep-rooted consequences for the next several years. And the proposed solution that we have is to allocate a small portion of the billions. And we've heard that might require a special session. Like you said, the bureaucracy of government. But if there's a will to do it, I think there's got to be a way they can get it done. I mean, where's the money? They're going to spend about $10 million a week. That money's going to be gone in a few weeks. And here we're going to sit. What if there's another wave? I hope or think there might not be, but if there is, that's money. That's a quarter of what we were asking for that could have kept existing people here and brought some people back. And so we think that there needs to be a emergent method of funding, whether it's through, FEMA, MEMA, or just a commitment for when they do get the $1.8 billion that they're going to have a hard time spending that much money. Let's help the soldiers who fought the war for us and who we need to keep us alive for the next 2 years.
Hear, hear. And they already have the money, Lee. I don't understand why they're not calling a special session. I don't understand why Lieutenant Governor Hoseman and Speaker Gunn aren't meeting with the governor daily on this. Hourly on this.
They are in favor, and I've reached out, to just about everybody. I think people are generally favorable to the concept. It's just we need the action. Now's the time for the action. We got to act. We can't wait 2 weeks or 3 weeks or a month. We need to get it done now for the sake of not just us at Singing River Health System. This is for the whole state of Mississippi.
And finally, Lee, before we let you go, your contingency plans. I'm with you. I think, we may be hitting this peak. The Delta variant all around the world seems to have had about a 12 to 14 week intense period, and then things begin to level off a bit. But what are your contingency plans if that doesn't happen and suddenly you find yourself needing to take care of 200 people a day in your hospital?
Well, Dave, all I can tell you is that the strongest, grittiest people have stayed, and they are giving their heart and soul to this community. They've given a lot, and they're going to keep giving. We're going to do whatever it takes. We're going to save every person. We're going to take care of every person, vaccinated or unvaccinated, COVID or heart or cancer, whatever your issue. They're going to keep fighting, and we're going to just fight the war in any way we can. We're not going to give up. So if we don't get it, it's going to be a big disappointment, but it's not the end of the world. But we're just going to keep slugging it out, and we're going to stay Singing River strong, as we say.
Lee Bond, CEO, Singing River Health System. Thanks so much for being with us, Lee. Always appreciate it.
Thank you.